Hi, Paula. Thank you so much for joining me today to discuss Acoer's Health Data Explorer. Um, just to give a quick um, introduction, Dr. Yoon is a member of our advisory board. She has over 30 years of experience working at the CDC, where she led initiatives to improve disease surveillance and data sharing. Most recently, as the director of Division of Health Informatics and Surveillance, she oversaw programs like the National Notifiable Disease Surveillance System and the National Syndromic Surveillance Program. So I think it's fair to say that I'm more than thrilled to be talking to you today and discussing Health Data Explorer, or HD as we call it, in more detail. We can dive straight into our questions.
Okay.
Healthcare data is often siloed and fragmented. This creates challenges for decision making as well as resource allocation. And from your perspective, how does then Health Data Explorer address these challenges, enable also more streamlined public health reporting?
Yeah, fragmented and siloed data is a huge problem for public health. In the United States, the role of tracking diseases and monitoring populations is primarily the responsibility of state and local health departments. The health departments collect their own data about their populations, and they also use healthcare data. But unfortunately, there's really no one standardized system in which all of these data are collected. The healthcare industry uses hundreds of different data management products, and states often use their own homegrown systems for data collection and management. There are a few systems that are used widely in healthcare and public health, but even these are often customized in some way so that the data can't be shared easily. Because the data sit in siloed systems and it's not easy to quickly access the data, analyze it, and produce meaningful insights. And also, there's so much cost and effort put into collecting and managing data that often analyses and reporting are overlooked, or the data are really not fully utilized. I think this is where the Health Data Explorer can be extremely helpful. With the Health Data Explorer platform, you can pull data from just about any system and create a workspace with the analytics and data visualizations that you need. And then it's super easy to create a tailored report. You can also share your workspace with others and tailor what each user can view. Currently, in public health, many reports rely on yearly data. But what public health really needs is more timely analyses and reporting with a lot less effort. So I really think Health Data Explorer can provide that.
Thank you. Yeah. Um, and then for our second question, the topic I wanted to touch on was the opioid epidemic, and it continues to have a devastating impact on communities across the US. How can improving cross-jurisdiction reporting and leveraging then platforms like Health Data Explorer help public health agencies develop more effective strategies for addressing opioid and substance abuse mortality?
Yeah, the opioid epidemic is a huge public health challenge, and it involves many sectors of our communities. And therefore, it requires data from many different organizations. For example, to get a full impact of the opioid epidemic on a community, it would be helpful to have data from hospitals, medical examiners, law enforcement, pharmacies, social services, and other organizations. The Health Data Explorer platform can be used to pull data from different sources, so you can create a more comprehensive report of what opioids are doing to a community. The workspaces can be shared with those that need this information, and the analytics and interpretations updated as frequently as necessary. In a similar way, data from adjacent communities, cities, or states could be analyzed and shared. Drug use trends, such as types of drugs or potency or even drug sources, seem to spread geographically. So this information could be really helpful across jurisdictions. It would also be helpful for jurisdictions to share data on the impact of interventions or new policies or programs that are being deployed to combat the opioid epidemic. Rather than, again, sharing a yearly report, health departments in different jurisdictions could share and monitor a common workspace on the HDE platform that will provide a much timelier and actionable information.
Exactly. Yeah. And I think it's also really important to mention health equity, which is critical when addressing the opioid crisis, but also many other public health challenges. How can Health Data Explorer then support equitable resource allocation, but also improve outcomes for marginalized communities that are often most affected by the opioid epidemic?
Yeah, to understand how the opioid epidemic or really any health problem might be impacting some communities more than others, the bottom line is you need data. Data on who is being impacted, where, when, and why. Analyzing these data and creating visual comparisons on a platform like Health Data Explorer can really illuminate the disparities. And of course, once you identify the disparities, then you can target resources and interventions where they have potentially the most impact. And if the interventions work, you should be able to visualize the evidence as well, or at least determine that something is not working and try to find out why. Wouldn't it be great to have a dashboard or a workspace on HDE that community organizations could monitor based on their own needs and frequency?
That's, yeah, a wonderful idea and shows how HD can be utilized. And in your view, what role should then federal agencies like the CDC play in supporting innovations like Health Data Explorer? Do you see any opportunities for these technologies to maybe help establish national standards for data sharing that we've already mentioned, or improve interoperability across jurisdictions?
Yeah, CDC plays a pretty significant role in supporting state and local health departments, primarily through funding, technical assistance, and working together to improve data standards. You know, it was just before the COVID-19 pandemic in late 2019 that CDC and state health departments began a data modernization initiative. And the goal of this initiative was to transform public health data management. I've already mentioned siloed data, the incompatibility of many data systems, and the tremendous cost and effort that goes into data collection and management. The goal of data modernization is to improve all of these ongoing challenges. So there has been some increased funding for these improvements, largely due to the COVID-19 pandemic. But as with all things public health, it's not nearly enough for a real transformation. So I think tools like the Health Data Explorer can be extremely helpful. For one thing, compared to many other tools, it's inexpensive. And you don't have to replace your existing systems. That's a big advantage. The data can be connected in a decentralized way. The Health Data Explorer workspaces also encourage collaboration, making it easier to work with anyone, anywhere, and of course, control who sees the data. Once the needed analytics and visualization processes have been put in place, creating timely reports and updating them as needed is, I think, super easy. CDC can't tell states which tools to use, but they can certainly work together to explore and identify tools that would further the goals of data modernization. And from my experience, I think Health Data Explorer would be an ideal candidate for that type of collaboration.
Yeah, and just quickly touching on another area of healthcare, cancer research often relies on diverse data sets from clinical trials to genomic data and public health records. How do you see Health Data Explorer being applied to unify and verify these data sources? And how might this improve insights and outcomes in cancer research as well as cancer care?
Yeah, cancer data, I think, is a great example of data that really spans medical and public health domains. The data needs may be slightly different. Obviously, medicine focuses on the treatment of individuals, and public health focuses on the health of populations. But they both need detailed clinical data. And like death investigations or infectious diseases such as COVID-19, cancer data can come from many different sources. So Health Data Explorer, which supports collaboration across many domains, can be used as a data repository and a workspace for data exploration and analyses. Another critical feature of the Health Data Explorer is the secure data exchange. Behind the scenes, Health Data Explorer uses blockchain technology to authenticate and verify information that are submitted from different sources. So Health Data Explorer can ensure secure data exchange across organizations, and it can allow you to set controls on who can see what data on the platform. As with any patient-level data, the protection and privacy of the data is paramount, and that applies to both healthcare and public health settings. The HDE tool lets you drill down to the different data layers so that persons who are authorized to view the case-specific data could do so, while others may be limited to aggregate data and analyses. But the beauty is that all of the users would be accessing the timeliest information. There would be no more waiting for yearly reports, and I think this will be a big advantage for both healthcare and public health.
Exactly. And I think it can really do a lot of good, not just for researchers, but also patients. So yeah,
Absolutely.
thank you so much, Dr. Yoon, for sharing your valuable insights with us today. It's been wonderful hearing your perspective on how Health Data Explorer can address some of these pressing challenges in public health that we mentioned. We really appreciate your time and expertise, and I look forward to continuing our work together.
Thank you, Sarah. I appreciate you having me.